How do esophageal varices change your diet and lifestyle? Imagine a tiny change in your daily habits that could make a big difference in preventing a serious health emergency. If you have esophageal varices, understanding how your diet and lifestyle can help protect you is essential. These enlarged veins in your esophagus are usually caused by increased pressure in the portal vein system, often due to liver cirrhosis. Because these veins can rupture and cause dangerous bleeding, managing how you eat and live becomes a key part of your care. When it comes to diet, the focus is on gentle, easy-to-swallow foods that won't irritate or injure the fragile veins. Hard, crunchy foods like chips, nuts, or raw vegetables can scratch or damage the esophagus, so it's best to choose softer options like cooked vegetables, mashed potatoes, or smoothies. Eating smaller meals more often, about every 2 to 3 hours, helps prevent excessive stomach stretching and reduces pressure on the veins. Large meals can increase pressure and risk tearing the varices, so smaller portions are safer. Limiting salt intake is also important because cirrhosis can cause fluid buildup in the abdomen and limbs, making symptoms worse. Reducing salt helps control fluid retention, but it's best to do this under a dietitian's guidance to avoid nutritional gaps. Contrary to old beliefs, eating enough protein is now encouraged because it supports muscle health and liver repair. Choose easy-to-digest protein sources like lean meats, eggs, or dairy, avoiding overly salty or processed options. Alcohol is a major concern because it worsens liver damage and increases portal hypertension, raising the risk of variceal bleeding. Caffeine should also be limited since it can irritate the gastrointestinal tract. Staying well hydrated is important, but if you have fluid retention or low blood sodium, your doctor might suggest fluid restrictions. Always follow medical advice on this. Lifestyle changes are equally vital. Avoid activities that increase abdominal pressure, such as heavy lifting, straining during bowel movements, or intense coughing. These actions can raise the risk of veins rupturing. To prevent constipation, which can cause straining, include fiber-rich foods in your diet and drink plenty of water. Regular exercise within your limits can help maintain overall health but should be discussed with your healthcare provider. Monitoring your condition through regular medical checkups is crucial. Your doctor may recommend procedures like endoscopic ligation to prevent bleeding from varices. If you have trouble eating or swallowing, your healthcare team might suggest nutritional support through tube feeding, especially around procedures, to ensure you get enough calories and nutrients. In people with cirrhosis and varices, malnutrition is common and can worsen health outcomes. That's why maintaining a balanced diet with adequate calories, vitamins, and minerals is essential. Sometimes, supplements are needed if absorption is impaired or dietary intake is limited. Every person's situation is unique, so personalized advice from your healthcare team is the best way to stay safe. In summary, managing esophageal varices involves eating soft, non-irritating foods in small, frequent meals, reducing salt to control fluid buildup, avoiding alcohol and caffeine, and limiting activities that increase abdominal pressure. Proper nutrition and lifestyle adjustments can significantly reduce the risk of bleeding and support your liver health. Always consult your healthcare provider for tailored guidance because every case is different. Taking these steps can help you stay healthier and safer while managing your condition.